Talk about normocytic anemias with intravascular hemolysis, which is predominant. And the first example is G6PD deficiency. Now, G6PD deficiency is an X-linked disorder. Okay, this has two variants. One is the African variant, and the other is the Mediterranean variant. The African variant is mild, while the Mediterranean variant is severe. Okay, so it has mild deficiency of G6PD, okay, and it has severe deficiency of G6PD. And individuals with this condition has both of these have some kind of protection against malaria. Okay, now we talk about the pathophysiology, and basically before we are also going to cover on the physiology of why it actually happens. So G6PD is, G6PD is an enzyme that, produces NADPH as a byproduct. So NADPH is a byproduct of G6PD, right, which is an enzyme. And this NADH is required for the reduction of regeneration of reduced glutathione, right? And we know what glutathione is required for, to reduce oxidation free radicals, right? So that's the major concept. So now when G6PD is less, then of course NADPH is less as well, right? Now, what does it have to do with red blood cells? In red blood cells, we know there is no mitochondria. So in red blood cells, there is no mitochondria, and everything that happens, all the metabolic things is carried out by glycolysis. And also, because there is reduced G6PD, so it means reduced NADPH, which is going to, in case of any kind of infection, then if a person is having any kind of infection, or it could be because, any kind of drugs, right? Some drugs of these examples are primaquine, right? Some sulfa drugs, right? And dapsone, right? These drugs, or fava beans, it's important to remember fava beans and favism, that's highly linked with G6PD. So in any of these cases, a patient with G6PD deficiency will not going to be able to have NADH, and when it has no NADH, glutathione will not work, right? Glutathione will not work, and this will cause oxidative stress. Now, this oxidative stress is going to precipitate the, this is going to cause your red blood cells to be damaged. And how the damage is that the hemoglobin will be precipitated, and they will form Heinz bodies within the red blood cells in RBCs. Okay, so that's the problem that damages the RBC. So when they go into the spleen, they will damage it and form bite cells. So you need to know this kind of flow of information how things happen. Now, the patient is gonna have hemoglobinuria, because HB is, in the blood, in urine. And then also back pain, severe back pain right after oxidative stress. Okay, that's that. Now, for tests or investigations, there will be one is called as screen that used to screen for this disease is called Heinz preparation. That screens. It's a screening test. And only precipitated HB is seen, and this stain is called as a Heinz stain, right? And to confirm this screening, we do a diagnostic test. That's the enzyme diagnostic test. And that is it for G6PD deficiency. Thank you so much.